In SSA, the prevalence of oral and anal sex among heterosexual individuals varies widely, and it appears that these behaviors are more common in certain groups, such as female sex workers, FSWs, and university students. Interestingly, research indicates that men tend to report higher frequencies of oral and anal sex compared to women. However, there are significant concerns regarding the use of protection, as many individuals engage in these activities without consistent condom use, which increases the risk of STIs, including HIV. Several studies highlight that individuals who engage in oral and anal sex are also more likely to participate in high-risk activities, such as having multiple sexual partners or using alcohol and substances during sexual encounters. These behaviors can significantly contribute to the transmission of STIs. Moreover, there is evidence suggesting that in some cultures, oral and anal sex are perceived as lower-risk activities compared to vaginal sex. And this misconception can lead to a lack of protection. For example, some believe that oral sex is risk-free, which can contribute to lower condom use. Additionally, there is a culture of silence surrounding these practices, where discussions about safety and protection are often overlooked. In certain regions, oral and anal sex can be tied to social pressures, such as financial incentives. Sex workers, for example, may engage in these activities to meet the demands of clients or to increase their income. There are also reports of adolescents engaging in oral and anal sex in exchange for gifts or money, highlighting the intersection of economic factors and sexual behavior. For young people, particularly university students, the prevalence of oral and anal sex is rising, much like in high-income countries. This trend can be attributed to changing perceptions of sexual behavior and the influence of social media, including pornography. This emphasizes the need for sexual health education tailored to young people to raise awareness about the risks associated with these practices. Oral and anal sex are recognized as key pathways for the transmission of STIs, including oral cancers and anal cancers. Studies suggest that while routine testing for these infections is common in high-intensive countries, it is not yet feasible in SSA due to resource limitations. However, educating the public about the risks of unprotected oral and anal sex is a crucial step in preventing STI transmission. It's important to note that the reported prevalence of oral and anal sex tends to be higher among males than females. However, this may be influenced by reporting biases, as men are often more likely to report higher numbers of sexual partners and activities. Social and cultural factors may also influence how people report sexual behaviors, with some individuals underreporting their experiences. In conclusion, oral and anal sex are prevalent sexual behaviors in SSA, but they are often associated with unprotected practices that increase the risk of STIs. More research is needed to fully understand these behaviors, especially in high-risk populations. It is critical to integrate discussions on these behaviors into sexual health education and policy to better address the challenges posed by STIs. By providing clear and comprehensive information on oral and anal sex and their associated health risks, we can improve awareness and promote safer sexual practices. If you found this video informative, please leave a like, share it with others, and don't forget to subscribe for more health content.